Hello, I'm Teresa. Welcome back to another episode of Teresa's TCM Clinical Reflections. Recently, I treated several patients with shingles. Although every case was different, these patients reminded me once again that traditional Chinese medicine is not simply about treating a rash. It is about understanding the whole person. Today, I'd like to share a few things I've learned from treating shingles in my own clinical practice. These are not rules. They are simply reflections from my everyday work as an acupuncturist. When most people think about shingles, the first thing they notice is the rash. That is completely understandable because the rash is easy to see. But over the years, I have learned that I shouldn't only look at the skin. I also ask myself, what is happening inside this person's body? Traditional Chinese medicine encourages us to look beyond what is visible. That way of thinking has become an important part of how I approach shingles. Many of the patients I have treated developed shingles after a period of stress, poor sleep, illness, or fatigue. From a traditional Chinese medicine perspective, I often think about Zheng Qi, the body's vital energy. When the body's resistance becomes weaker, recovery may take longer. That is why I don't only focus on the shingles itself. I also choose acupuncture points that help support qi and blood, hoping to strengthen the body's own ability to recover. For me, helping the patient become stronger is just as important as helping the rash heal. Another thing I always pay attention to is where the shingles appear. Different patients have different meridian pathways involved. Some follow the Xiao-Yang meridian. Others appear along the Yangming or Taiyang meridians. Sometimes the daimai is involved. The rash may look similar, but the meridian tells a different story. Understanding that pathway helps me decide how I want to approach treatment. Pain is often the most difficult part of shingles. When the pain is significant, I often use surrounding needling around the affected area. Rather than searching for fixed acupuncture points, I gently place shallow needles around the painful region. From a traditional Chinese medicine perspective, this helps encourage the movement of qi and blood around the area. Many patients tell me the pain gradually becomes easier to manage. Sometimes I also include treatment closer to where the affected meridian begins. If the shingles appear around the chest, I may treat the upper back. If they affect the leg, I often include the lower back. If they involve the arm, I may work around the neck. Depending on the patient's condition, I sometimes combine acupuncture with gentle bloodletting. Again, my goal is not simply to treat the skin. It is to support the entire meridian pathway. When I feel that yang qi is weak, I sometimes add moxibustion. The gentle warmth helps support the meridians and improve circulation from a traditional Chinese medicine perspective. Patients often tell me they feel warmer, more relaxed, and more comfortable during treatment. For me, moxibustion is another way of supporting the body's recovery rather than only treating the. One thing I often explain to my patients is that treatment does not necessarily finish when the rash disappears. Recovery continues. We also talk about sleep, nutrition, stress management, and gentle exercise. Helping the body recover its strength is an important part of preventing future illness. Traditional Chinese medicine is not only about helping people recover from disease. It is also about helping them stay healthy afterwards. After treating several patients with shingles, one lesson has stayed with me. Healing is much more than making the rash disappear. Traditional Chinese medicine has taught me to look after the whole person. When patients begin sleeping better, feeling stronger, and recovering their energy, I know we are moving in the right direction. That holistic view of the meridians continues to guide every patient I see. It reminds me that good treatment is not only about reducing pain, it is also about helping people regain confidence in their own health. Thank you very much for joining me today. I hope today's clinical reflection has given you a better understanding of how I approach shingles through the principles of traditional Chinese medicine. Every patient teaches me something new, and I look forward to sharing more of those experiences with you in future reflections. Take care of yourself, and I'll see you in the next episode of Teresa's TCM Clinical Reflections.